I'm really looking forward to this conversation about SNAP, or the Supplemental Nutrition Assistance Program, and the latest data available from the Congressional District Health Dashboard. So before we dive in, I just want to emphasize what's at stake right now. And Sunita covered some of this, but I think it bears worth repeating. Based on national data, we've seen that 3 million people have lost SNAP benefits since July of last year in the wake of the Big Beautiful Bill. And importantly, as more parts of the bill take effect, and with other policy discussions that are happening right now, it's likely that another million people could either lose benefits or see them drastically reduced. So that makes conversations like today not just timely, but very, very necessary. We need clear, credible data to ensure that decisions in Washington and across the country reflect the real needs of communities. And no one, especially kids, people with disabilities, veterans, older adults, should be left wondering if they can afford their next meal. And that's really where SNAP comes into play. It is a government program that helps people afford their groceries. And as Sunita said, 42 million people in this country benefit from it now. It began in 1964 and was originally called food stamps. And importantly, it has enjoyed bipartisan support throughout that history through its inclusion in the Farm Bill, which sets the nation's food and agriculture policy. So let's talk a little bit about some of the specifics. The application process and paperwork for SNAP varies a little bit from state to state, but generally SNAP is intended to serve those living near or below the federal poverty level, which for a family of four this year is right around $31,000. Close to 4 in 10 people receiving SNAP in the US are children, but it also serves seniors, people with disabilities, and many, many adults who are working but still not able to afford the basics. On average, individuals receive a monthly benefit of $188, and the average household receives $332 per month. So that works out to about $1.50 per meal. In addition to US citizens, green card holders are eligible for SNAP after a 5-year waiting period. Up until recently, other lawfully present immigrants were also eligible, but policies have changed and many have lost benefits. I'm going to talk more about that after Dr. Thorpe presents her information. And it's important to note that undocumented immigrants are not eligible for SNAP and have never been eligible. So to fully understand both the reach of SNAP and the real world impacts of policy changes that are happening right now, we do need high quality data. And at RWJF, we believe local data are key to informing policy change, strengthening accountability, and driving collective action. That is why we've invested in tools like the Congressional District Health Dashboard. We had really heard from partners for a long time that enough reliable data wasn't available at the level of congressional district to engage policymakers on pressing matters of health and well-being. So the CDHD fills that gap. It provides free user-friendly data on more than 40 health and social factors for every congressional district in the country. And it really has become a go-to resource for journalists and advocates, including our own policy team at the foundation. So with that, I'm going to pass it now to Dr. Lorna Thorpe to talk more about the dashboard and the new SNAP data that were just released.
Thank you, Giridhar, and thanks for including me in the briefing today. It's wonderful to see so many people interested in this topic. My name is Lorna Thorpe. I'm one of the principal investigators of the Congressional District Health Dashboard. I'm also chair of the Department of Population Health at NYU Grossman School of Medicine. And we are really pleased to have partnered with Robert Wood Johnson Foundation, with Giridhar and others, to first launch and now actively maintain this dashboard. Like Giridhar said, our mission on the Congressional District Health Dashboard is to provide data on more than 40 measures of health and drivers of health, parsed to the boundaries of every congressional district in the country, and we update those data to new congressional district boundaries when they are modified. And in a moment when SNAP policy is actively changing, we believe that having timely local data on SNAP participation is more important than ever. So we're pleased to introduce a new SNAP metric. This metric measures the percentage of households that are participating in SNAP, and we generate these estimates by combining data from the American Community Survey and the U.S. Department of Agriculture's Food and Nutrition Service. We provide SNAP estimates for each quarter of the year, and those are 3 consecutive months. And we currently have SNAP data spanning from the end of 2022 through the fall of 2025. And we'll be updating the data twice annually to allow for the tracking of policy impacts. And this updating and quarterly cadence is key because it allows users to see changes as they happen rather than waiting years, which is what many data sources do. At the dashboard, our goal is to make sure that users have the right data at the right geographic level to understand how federal policies affect communities, which can then be used to help hold leaders accountable and inform policy change. We are a nonpartisan source for rigorous, transparent methods, and that's very important so that all sides of the political spectrum know that we're a reliable and trustworthy source of data. And as you'll see when I demonstrate the dashboard in a moment, the dashboard doesn't just show health outcomes, it shows conditions that shape health, including housing, education measures, income, access to care measures. And SNAP participation now sits alongside those measures, helping you connect the effects of federal nutrition policy to community health outcomes. Let me highlight a couple of key takeaways from the data so that you can see how SNAP participation has varied over time and how it varies across the country. Our data show that on average, across all congressional districts, more than 1 in 6 households in the United States participate in SNAP. This underscores that SNAP is a large program in our country's safety net supporting low-income families and individuals. And at a high level, what we're seeing is that SNAP participation remained relatively stable over the prior few years through the Q3 of 2025. Between the end of 2022 and 2025, average SNAP participation only varied slightly up and down from a high of 17.9% of households in one quarter to a low of 17.2% of households in another quarter. And these differences between quarters is small, but remember that even a small percentage is still a large number of households. For example, the difference between 17.2% and 17.3% is equal to over 130,000 households in the country. While the trends over time have been relatively stable, geographically, there is wide variation in SNAP participation between districts. Some districts have as low as 3% of households, and others have as high as nearly 60% of households participating in SNAP. And the percentages can change a lot within the same state across districts. For example, in Georgia, SNAP participation ranges from 5% to 32% across its districts. And in Ohio, the participation ranges from 8% to 27%. To give you a sense of how the dashboard works, I want to transition to share my screen for a brief overview so that you can explore SNAP participation on our website as well. And you'll see that anyone from a member of Congress to a community advocate or journalist can easily explore and understand these data on their own. It's very intuitive. Sunita, can you confirm that the dashboard is visible? Great.
It is.
All right. This is the home page, and either from the home page or from Health Snapshots, you can type in a district that you're interested in or a state. For example, you can type in Michigan and choose a state or choose any of its congressional districts. There are 13 in Michigan. Or if you don't know your congressional district, you can type in your address and this will bring you to your congressional district, or in a few instances, one or two, and you can determine which one is yours. But I'm going to start at a national level. Up here at the top, if you select metric maps, you can see all of the measures on the Congressional District Health Dashboard. We have health outcomes, social and economic factors, health behavior metrics, physical environment metrics, and clinical care metrics. And under social and economic factors, you see the new measure we're talking about today, SNAP participation. So when you click on that, you immediately get a map of the United States. And you can see that, I'm just going to go out a little bit because I know it gets cut off for some people. Here, you can see that in the quarter 3 of 2025, on average across all of the congressional districts in the United States, 17.4% of households were participating in SNAP. And this is a scale bar that shows the range of participation by congressional districts from a low of 3% to a high of 60%. And the colors on the scale bar correspond to the colors on the map below in the United States. And you can see some areas in California have very small districts. And on the East Coast, similarly, very small districts. So you might need to zoom in to look at those. Other districts are contiguous with state boundaries when it's sparsely populated areas. And so you can zoom in on, say, California by zooming in, or if you want a nice crisp look, you can type up here, California, and you get a view of a state. And here in California, you see a lot of variation in SNAP participation, and that on average in California, SNAP participation is higher than the national average across its congressional districts. 17.4 is the national average. Nearly a quarter of Californian households are participating in SNAP. And you can see certain areas of California, in particular the Central Valley. This is California's 22nd district. That corresponds to around Bakersfield and has half of households participating. And over here, California's 21st district, which corresponds to the Fresno area, has over 50% of households participating in SNAP. Now you can change the metric time period. So if you wanted to go back to the final quarter of 2024, you could do that. And you could see that California was 22% in 2024 compared to 24% in quarter 3 of 2025. So you can change metric time periods, or you can zoom in or select a particular district. So if you looked at, first of all, at California's 22nd and you viewed the district, you can see this is Bakersfield, Porterville, and you can get a snapshot of that district and see that the age population, it's a relatively young district with less than 10% that are over the age of 65, predominantly Hispanic community. I'm going to zoom into a different congressional district in California. Go up to California's 12th district. Which is just outside of San Francisco, the Oakland, Berkeley, Alameda area. Now this has a similar level of SNAP participation as the state average. 24.7%. And if you wanted to look at other measures on the dashboard to see how do they compare in this district compared to SNAP participation. SNAP participation is above the US average. You can select change metric and say, look at children in poverty. And you can see that the percent of children in poverty in this area is 12%, which is lower than the national average. Or you could look at unemployment, and you could see that unemployment is higher than the national average in this area. And for many of our measures, we also have smaller area estimates within the Congressional District Dashboard, census tract level measures. So you can actually look at unemployment by census tract within the Congressional District. And you see a lot of variability here, with some areas having very high unemployment, some census tracts, 18%, and other areas having very low, 3% unemployment. If you were particularly interested in one area, you can customize the area. Let's say you're very interested in just South Berkeley. You could select a few census tracts and say, we work in this area. We would like to know how to support people in the South Berkeley area. You can get a specific estimate for the area of your selected census tracts. And this census tract estimates are shown here. And then the average of the areas that you selected is shown on this scale bar here. We also have metrics by demographics and health snapshots. So if you wanted to get a big picture of what was happening in California's 12th, you can take a full health snapshot. And this is a list of all of our metrics. So the metric name is listed here. The actual value of the metric is in the middle column. And then on the right, it tells you whether this district is doing better than the US average, which is a green circle, better than average. A orange triangle is about the same as the national average. And then a red square is worse than average. And you can see this district has some measures that it's doing worse, some measures that it's doing better, and some measures that are the same as average. So I'll just stop here with the demo. I will just end by saying I really do hope that you take a look and view the dashboard yourself. What's great about it is that it provides more detailed local data, and now it provides an important baseline for SNAP-related policy changes as they go into effect.
I want to get into the data as well. So they are hard to resist. And thank you, Lorna, for just giving us a glimpse of how powerful they are. So as Sunita said, I want to focus now on why SNAP is so important, and also what's changed in the past year and what that means for people and communities all across the country. And I see questions coming in that are about these issues. So first, we know that substantial research shows the widespread benefits of SNAP for participants and their communities. So here are a couple things. We know that SNAP lifts children and families out of poverty, and it's a proven boost to the economy as a whole. Second, it can really stabilize neighborhoods and communities, helping families weather financial hardship and relieving pressure on local food banks, and we can talk more about that. SNAP also, importantly, improves health. I'm trained as a family physician and have worked in public health for years. And SNAP is one of the most amazing public health policies and programs that we have in our country. It improves the health of infants and children. It can boost academic performance among kids, and it can encourage healthier purchases and healthier eating, especially when you pair SNAP with incentives for things like fruits and vegetables. So amazing health and economic program. Unfortunately, despite these benefits, the Trump administration passed a law, as we already talked about last July, that has resulted in severe cuts to SNAP. And I want to walk through four important ways that the program has changed. First, the law dramatically expanded work requirements for SNAP. There have always been some work requirements for most adults in the SNAP program. But it's important to note that the majority of SNAP participants who can work do work. With this expansion in work requirements, the requirements now also apply to older adults, 55 to 64 years of age, and it also applies to parents of teenagers as young as 14. Lastly, it strips exemptions from work requirements for veterans and others. So what's the bottom line in terms of these work requirements? What we know from prior experiences in SNAP and other programs like Medicaid is that work requirements don't work. They do very little to increase employment, but they lead to huge drops in participation. And that's because the paperwork is very confusing and time consuming, both for people who are working and want to document that, but also for people seeking exemptions like those with disabilities. So the second change that the law made is that it shifts significant costs for the SNAP program from the federal government to states. So states have always shared some of the costs of running the SNAP program, the administrative costs. But beginning in October of this year, states will have to pay for 75% of the administrative expenses. It used to be 50%, now it moves up to 75%. But what's even more worrying is that starting in 2027, most states are going to actually have to start paying a portion of the actual food costs. They have never had to do that. And they will have to cover anywhere from 5 to 15% of the food costs, which can be hundreds of millions of dollars per year. The third big policy change is that the new law took benefits away from some lawfully present immigrants, including refugees, asylees, and trafficking survivors. This is really heartbreaking. These changes, combined with wider anti-immigrant actions by the Trump administration, are having a chilling effect, leading to drops in participation among eligible, lawfully present immigrants and among citizen children of undocumented parents, so children in mixed status families. Okay, the fourth change that is important to know about is that over the next decade, the law reduces benefits for everybody who participates. SNAP benefits are calculated based on food costs and some other data. And for the first time in a generation, that calculation was updated in 2021. And what that meant was higher SNAP benefits to reflect the current reality. Unfortunately, what the July 2025 law did is that it permanently froze benefits at the current level. So they're not going to change and grow with inflation and as demands increase. That means cuts to benefits for everybody in the program. So I know that was a lot of policy information, but the bottom line is something that Sunita mentioned, and that's that SNAP's budget will be cut by nearly $190 billion, or 20% over the next decade. And 4 million people, including 1 million children, will either lose their benefits or see a drastic decline in the value of their benefits. And we know the administration is using other legislative and regulatory tools to cut SNAP as well. That's why these new data from the Congressional District Health Dashboard are so important. As Lorna said, they're a baseline for further changes that we're going to see over the next several months and years. And it's a way to hold leaders accountable and to make sure that people in our communities know about what's happening with SNAP, because it truly is a lifeline for so many. So thank you again to Lorna and her team for this important work. And I think I turn it over to Sunita now.
Yes, you do. Thank you both for that fascinating information. And we've got a ton of questions in the chat. Dr. Thorpe, I wanted to start with you first. The demographic data you have amassed on 40 indicators of health is such a fantastic tool for a room full of ethnic media reporters. Could you please demonstrate this portion of the dashboard?
Absolutely. I'm pulling it up again. And
Thank you.
what Sunita is referring to is we have on as many measures as possible, we try to break the data down by demographics so that we can understand differences between age groups, sex, and by race ethnic groups as well. If you go to metrics by demographics, we don't, and you, so let's stay with California. California's 12th. The dark measures are the measures for which we have the capacity to give demographic breakdowns. And so if you were to look at, let's say, life expectancy, and you can see the average life expectancy in this congressional district is 82.9 years, and that females who live in this district have a higher life expectancy than males. And then you can, and that's consistent with national trends.
Mm-hmm.
But what you can also see is in this district, how does life expectancy vary across different racial ethnic subgroups, with higher life expectancy rates for Asian and white and Hispanic residents compared to Black residents in this district. If you change a metric and you look at, say, unemployment, we have unemployment measures by sex, by race, ethnicity, and by age, and you see higher rates of unemployment in younger ages here. So that's another asset in the dashboard. Metrics by demographics. Oops, I just lost it. California's 12th. And breast cancer deaths. And so here you see very disparate levels of breast cancer mortality among Asian, Black, Hispanic, white women in this district, with the highest rates of breast cancer mortality among Black women.
Dr. Mallya, the fear of immigration action has kept many immigrants and their families from availing of the benefits for which they are eligible. And you can see a number of questions in the chat on this specific topic. Do you expect a voluntary drop-off of SNAP participants over the next couple of years?
The short answer is yes. And I think voluntary is one way to describe it. I think people are really being forced off through draconian, really unjust policies. And we're seeing that with SNAP, with Medicaid, with community health centers. People are afraid in many communities, immigrants, regardless of their immigration status, to leave their homes. And that is the reality of so many of our neighbors and fellow residents of this country right now. So we've already seen it, Sunita. We have seen drops in participation in a number of public programs, including SNAP among immigrants. And that is for immigrants who are citizens, that it includes immigrants who are green card holders, and that includes children who are citizens but whose parents may not be. And I've already talked about some of the reasons why. One is that certain groups of lawfully present immigrants have been excluded from SNAP, like refugees and asylees. The second is that we're seeing this inhumane immigration enforcement happening in arbitrary ways all across the country. And third is that this administration has chosen to weaponize these public programs by sharing data, very detailed data from programs like Medicaid with immigrations and custom enforcement. So all these things create real fear, understandable fear among immigrants, and it is leading to participation drops, and we're likely to see even more of that.
Thank you. Let's go to questions from reporters. Araceli Martinez, will you ask your question first, please?
Well, I was wondering, do you have information regarding how many people in California, particularly within communities of color, have been impacted? For instance, how many are Latinos, Black or Asian, and what will be the consequences of this cuts, specifically if they may lead to an increase in malnutrition? Thank you so much.
Thank you. What we have on our dashboard is through what we call the baseline through September 2025. And so the one big beautiful bill that Dr. Mallya has described and the impacts are really beginning after that. So this is the baseline. We don't yet have good data on the dashboard about how the decrease in SNAP participation has unfolded in California. We are seeing news reports and there's information coming out, but it's not yet at the aggregate level that we can present. Dr. Mallya, do you want to add anything?
Yeah, I guess what I'd add is that the dashboard is an amazing tool, and it is particularly tailored to data at the congressional district level. There are other partners of ours who have been able to report more recent data at higher geographic levels. Some of that data is still
provisional.
Yes, it's provisional. But what we know from some of those other data sources is that since July of last year, about 300,000 people in California, there's been about a decline of 300,000 in SNAP participation in California. And more broadly, we know that certain groups are overrepresented in the SNAP program. And that is because of the longstanding economic inequality that we see in this country, especially based on race and ethnicity. So Black households, Latino households, certain Asian American and Pacific Islander communities are overrepresented in the SNAP program, again, because of the underlying economic inequality that we have in our nation. So based on that, we know that when SNAP participation declines because of policies like the ones we've talked about, it is these racial and ethnic minority communities that are going to be affected disproportionately.
Do any of the individuals and families who've lost SNAP benefits have any other local, county, or federal government options for receiving replacement funding? And also, are any of these federal cuts and changes to the SNAP program reversible by a future administration?
So there are some other resources available, but they're insufficient. Those resources include other government programs like the WIC program, which is available for pregnant women and young children. The benefits are on average much smaller or lower than through the SNAP program. There are food banks, of course, all across the country that are run through secular, faith-based, and other entities, but they cannot come anywhere close to filling the gap that we see when SNAP benefits are lost. One way to think about this is that for every one meal that food banks provide, the SNAP program provides 9 meals. So the scale is just extraordinarily different. Many states and communities are trying to mobilize and fill in the gaps as best as they can, and that is noble, heroic work. But it's not going to be enough to make up for what we lose through the SNAP program.
Are they reversible by a future administration, the cuts?
They are reversible, but it will require action from Congress.
And Dr. Mallya, just to follow up on that, states will have to fill in the gaps here. Is there the political will to do so?
Yeah, so as I mentioned before, states are going to have to pick up new costs, both administrative costs and food costs. And that is going to put enormous pressure on their budgets. State budgets are tight every year. And unlike the federal government, states have to balance their budgets every year. So if they don't have enough to pay for everything that they need to pay for, they either need to raise revenue through taxes or they need to cut programs. And what we've already seen, especially in a state like Arizona, I saw a question about that. Arizona's already made cuts to the SNAP program in anticipation of these future costs that they're going to have to take on. Even in states that may have the political desire to mitigate some of the federal cuts, it's going to be very, very hard for them to do so without raising additional revenue. So that is the very tough situation that states are going to find themselves in.
And Dr. Thorpe, just for you, could you share some key examples of how the CDHD has shaped policy at either the state or federal level? How widely is this dashboard used by policymakers?
Thanks, Anita. We launched in 2023, so the dashboard is 3 years old, but it has very quickly become a trusted source for congressional staff, for advocates, for researchers, and for journalists that are seeking timely district-level data. Policymakers are generally using the data to better understand how federal programs affect local communities, and so we have, together with Robert Wood Johnson Foundation, held Capitol Hill briefings that have focused on helping staff use district-level health data to identify priority needs in their districts. And then those congressional staff members often contact us later to ask additional questions about the dashboard or engage with us. We also work with a lot of public health groups and coalitions like the Bipartisan Policy Center, the National Rural Health Association, Salud America, and others. And many of them promote the dashboard as a tool to identify emerging health and economic concerns and to help shape prevention-focused policy strategies. So we've contributed in a number of ways that way. The media has really picked up on the dashboard, particularly around Medicaid enrollment. We released a Medicaid enrollment measure less than a year ago, and this was exactly during the debates over the federal tax and Medicaid proposals around the One Big Beautiful Bill. And so journalists used those data to illustrate how proposed cuts to Medicaid could affect families' health and economic security, and showed in different states, which districts had the highest numbers of Medicaid enrollment. And this was featured in a number of national media outlets.
Our next question comes from Pamela Anchung of Immigrant Magazine. Pamela, welcome. Please ask your question.
In those mixed status families where the parents are undocumented or illegible, what about the children that are citizens? How do we protect the children if the parents can't access the SNAP benefits?
Yeah, it's an important question. So per the law, those citizen children continue to be eligible. And undocumented folks in this country have never been eligible for SNAP. So first, I just want to say that. But what we are seeing is that citizen children with eligibility for SNAP or with Medicaid are losing those benefits because their parents, their caregivers, are fearful of engaging with government programs. And it is a very tough situation. And I think immigrant rights advocates and even health advocates are really focusing on helping families meet their highest priorities. And they are not sugarcoating the fact that there are risks, unfortunately. So I think the guidance is on a family by family basis. I think it's important to make sure that the families understand what the law is and who is and isn't eligible. Ways that they can sign their children up that potentially might make them feel safer. So many immigrant rights groups have been helping families sign up for benefits in places that are trusted for them and in which they feel comfortable and safe. But it really leaves these families in a difficult situation because we're seeing all the ways that programs like this are being used to trap immigrants in very difficult situations, and using these programs as a way to fuel the detention and deportation that we've been seeing all across the country.
Our next question comes from Renee Barbie. Renee, please ask your question.
I live in Southern California and people are really hurting who are on SNAP. It is so sad. A lot of people are in need of food. What other resources are there?
I'll just reinforce food banks of various types in communities are key. And there are many food banks that particularly serve immigrant communities that are run out of faith institutions, community-based organizations. So I think that is very important. Many cities and counties, including my own here in Philadelphia, are trying to make information about food banks and other free food resources even more available and easy to find. So I think in some communities you can rely on local public health departments or local city or municipal agencies for information about other sources of food. And then a wonderful resource for all across the country is Feeding America, which has been mentioned before.
Feeding America. Okay, because a lot of the food banks around the Pomona area are lacking food sources. That's why I asked.
Yeah, that's a real issue with just the high food prices. Food banks themselves are struggling. And I'll say again, for every one meal that a food bank provides, 9 are provided by SNAP. So they cannot fill in the gap by themselves.
Another thing that some local governments are doing is really helping constituents understand the new work requirements and determine how to meet them. And in some instances, certain volunteer work can be used to meet those requirements. And so local governments and community organizations are really working together to try and help those, the ones that are not eligible for a waiver.
Have national averages for hospitalizations and doctor visits changed since SNAP benefits were cut?
I don't think we can answer that question reliably, but I really appreciate the sentiment behind the question. And I can mention a couple things, and Lorna probably can as well. One is that there is good research showing that SNAP can be an important tool in helping people manage their health conditions. Particularly for seniors, there's one study that I'm thinking about that shows that when low-income seniors access SNAP benefits, they're more able to afford their prescription medications, and it might also reduce hospital admissions. So even though we don't have the data right now to say that the drops in participation have led to more hospitalizations or poorer health, we can expect, based on other research, that we will see impacts like that. And it connects to another question around costs. I think what the government will say is, yeah, we're saving $190 billion by cutting SNAP. But we know that when you cut SNAP, it has impacts on people's health, like we just described, and on the local economy. I think it's a conservative estimate is that for every $1 of SNAP benefits, there's about a $2.50 impact on the local economy. So you can't just look at what the government says will be savings without thinking about all these unintended consequences that also lead to higher costs.
Rebecca, the one other thing I would add is it will be particularly challenging to tease this out. Is this due to SNAP? Because we're also seeing changes on the Medicaid enrollment front. And so there are a number of federal policies that may be impacting the health of residents happening at the same time.
Dr. Thorpe, what are the sources to populate the dashboard? You mentioned the census. What are some of the other sources that you use?
And because there's a number of them, I responded in the chat this time, but I'll tell the whole group. We use a number of sources: the census, the American Community Survey, data from the National Center for Health Statistics, where we get information about births and deaths, as well as major federal surveys, such as the Behavioral Risk Factor Surveillance System Survey and measures that come from that, as well as a variety of other additional data sources. One of the things that we do at the dashboard is work with a wide range of partners across the country to generate important new metrics and bring them to the dashboard. You can find information on all of our data sources in our technical documentation, which is on our website, but I put a link to the technical documentation in the chat.
Thank you. And just to follow up, how can reporters on this call know when you have updated the dashboard to be able to scoop stories relevant to their readers and viewers as soon as the new information is released?
I can give you an advanced scoop right now.
Okay.
We will have new SNAP and Medicaid data on July 22nd posted this summer. So stay tuned for that. And we also offer an advanced embargo list for journalists if you're interested in early access to upcoming data releases. And we welcome reporters signing up for our newsletter, following our social media channels. We regularly release announcements about new data or key findings, or there may be really interesting story ideas there. And we always welcome reporters reaching out directly with questions. We are happy to give interviews, provide data, give some background briefings where possible.
How do the $187 billion in cuts specifically undermine the health equity of aging populations and caregiver groups that often rely on SNAP to offset high medical costs?
As mentioned before, yeah, many seniors are on the SNAP program, and in addition to being on fixed income, SNAP becomes even more important for them in terms of being able to afford their groceries. I think one important implication here is that work requirements previously did not apply to adults 55 to 64, but now they do. That is a population that is particularly vulnerable. Those older adults may have stopped working, but they are not yet eligible for programs like Medicare. And now they will have to either document that they are working 20 hours per week, or that they are volunteering, or that they have some exemption, like a disability or like being the primary caregiver for a child. But as mentioned before, these documentation requirements, and that's actually another way to think about work requirements. They're not really work requirements, they're documentation requirements, they're paperwork requirements. They are very cumbersome. And we know that from past experiences with work requirements in the Medicaid program. And many people, including seniors and older adults who may be working or who may have a true exemption, aren't actually able to document that in a way that satisfies the state. And that's happening at the same time that state and local SNAP offices that have to process all this new paperwork are losing staff and funding. So it is a real recipe for disaster, and for many people, including older adults, losing benefits, even though they really should be able to keep them.
So talking about California, why do you think in the state with the world's fourth largest economy, there is such a high number of SNAP recipients? Thank you.
Each state makes great efforts to enroll people who are eligible into SNAP. And California doesn't necessarily do a better job than other states. It's more, I think, around the cost of living in California, the very high cost of housing. There are a lot of families that have relatively low wages. So it's less that they do a better job of enrolling people. I think it's more around in California, the cost of living. Dr. Mallya, I don't know if you have more thoughts on that.
Yeah, I think that's right. I mean, generally, SNAP participation mirrors poverty rates and unemployment rates. And I think that those are the biggest drivers of what SNAP participation looks like state to state and community to community. So I'd agree there. And while it's a wonderful idea for states to have their own SNAP program, none do. And it really comes down to the costs. Each state, their SNAP programs are hundreds of millions of dollars, and in maybe the largest states, over $1 billion. So for states to have their own programs is financially very, very difficult. And while we would hope to see something like that, I think it is very unlikely that we will.
Dr. Thorpe and Dr. Mallya, final remarks from each of you. Dr. Thorpe, let's begin with you.
I will just say that SNAP is a lifeline for millions of families, and these new data provide a baseline for what's happening on the ground. When we pair it with the other dashboard data on health and factors that influence health, we can begin to see how SNAP policy changes are affecting communities across the country. And so please stay tuned for our next update in the summer when we plan to add more SNAP data and more Medicaid enrollment on the site. And thank you.
It is a lifeline, as Lorna said, and it is a public health success and one that's worth protecting. So I hope you all can use the data that are available through the dashboard to tell stories about what SNAP means to children, to families, and to your communities, the communities that you care about and write about, because it's those stories that I think can move people's hearts, can move the heart of policymakers, that can move the heart of others that are going to need to take action to protect SNAP and hopefully expand it over time. I think in the richest country in the world, we can do better. And it's stories like the ones that you are going to tell that can help us make a difference.
Dr. Thorpe and Dr. Mallya, thank you so much for joining us today.